these are the various triangles in the cavernous sinus and the middle cranial fossa, the various triangles. So this is the summary of the picture. So you may not be able to understand directly if you see this picture. So now we will come to this picture in a step-by-step dissection manner. So these are all the pictures taken from Rhoton's atlas. So now what you see here is, okay, so this is the middle cranial fossa. So this is the tentorial edge or the dural reflection. This is the tentorial edge. Okay, so this is the dural reflections. So the cavernous sinus extends from the lower border of this dural reflection or the lower border of the tentorial edge. Okay, so this is the third nerve. This is the fourth nerve which is entering, and this is the internal carotid artery, and this is your second nerve, optic nerve. So now what we are going to do is, this dural reflection is going to be removed. So now this is the tentorial edge, but the reflections are removed. Just look at the parts which, there will be lots of markings. Just look at the parts which I have boxed, okay, which I have squared. Okay, just look at that alone. So this is the tentorial edge. So now this is the third nerve which is entering. Just below the tentorial edge starts your cavernous sinus. Okay, so the third nerve enters the roof of the cavernous sinus. The fourth nerve again enters at the roof of the cavernous sinus. And here is the posterior root of the trigeminal nerve. Okay, this is the posterior root of the trigeminal nerve, fifth nerve. So, and this is the superior petrosal sinus which is traversing above the third nerve, above the posterior root of the trigeminal nerve. This is the superior petrosal sinus. And this is the dorsal root of the trigeminal nerve. So here lies the Meckel's cave. So here is the Meckel's cave. And here lies the superior orbital fissures. And this is the anterior clinoid process. Just on the medial aspect of the anterior clinoid process lies the carotid artery. So the medial aspect of the anterior clinoid process lies the carotid artery and the optic nerve. Okay, so this is the anterior clinoid process. So again repeat now. So now this has been the dural reflections, and this is the tentorial edge. The cavernous sinus extends below the tentorial edge. Okay, now the dural reflections are going to be removed. So now the dural reflections are removed. So this is the tentorial edge. So this is the third nerve and fourth nerve which is entering the roof of the cavernous sinus. This is the dorsal root of the fifth nerve, and this is the superior petrosal sinus running above the fifth nerve, and this is the Meckel's cave. So actually what you see here is the arachnoid granulation or arachnoid projections which is extending from the posterior fossa and extends up to the middle of the Meckel's cave or middle of the trigeminal nerve. So what you see here is the arachnoid membranes. Okay, what you see here is the arachnoid membranes after reflecting the dura. So now the arachnoid membranes is also removed. Okay, now the arachnoid membranes are clearly removed now, and the superior petrosal sinus is being cut to expose the posterior root of the trigeminal nerve. This is the superior petrosal sinus. This has been ligated now. Okay, and what you see here, this is the third nerve, and this is the anterior clinoid process. Medial part of the anterior clinoid process lies the internal carotid artery. Okay, so this is the oculomotor nerve entering the roof of the cavernous sinus. This is through, it enters through the oculomotor system, and this is the trochlear nerve, the fourth nerve entering through the trochlear system into the roof of the cavernous sinus. And what you see is the dorsal root, posterior root of the trigeminal nerve, and this is the fifth nerve ganglion. Okay, this is the fifth nerve ganglion, and then it divides into V1, V2, and V3. So corresponding to these are the pericavernous venous plexuses which drains into the cavernous sinus. Hope you are all clear with these anatomical descriptions. So as step by step as we move inside, we will be dissecting one part by part, and then we'll reach the foramens now. So you need to have a basic understanding of what is now being exposed.